Omeprazole is a widely prescribed medication used to treat a variety of gastrointestinal conditions, including acid reflux, heartburn, and stomach ulcers. As a proton pump inhibitor, PPI, it works by reducing the amount of acid produced in the stomach, providing relief for those suffering from these common digestive issues. However, in recent years, there has been growing concern about a potential link between the long-term use of omeprazole and the development of dementia, a devastating neurodegenerative condition that affects cognitive function and memory. Understanding dementia and its impact. Dementia is a broad term that encompasses a range of disorders characterized by the progressive decline of cognitive abilities, such as memory, thinking, and problem-solving skills. Alzheimer's disease is the most common form of dementia, accounting for approximately 60–80% of all cases. Dementia can have a profound impact on an individual's quality of life, as well as their family and caregivers, making it a significant public health concern. The potential link between omeprazole and dementia. The potential connection between omeprazole and dementia has been the subject of numerous research studies and ongoing scientific investigations. Some studies have suggested that the long-term use of PPIs, including omeprazole, may be associated with an increased risk of developing dementia. However, the exact mechanisms behind this potential link are not yet fully understood, and the scientific community remains divided on the strength of the evidence. Research studies on omeprazole and dementia. Several studies have explored the potential relationship between omeprazole and dementia. A 2016 study published in the Journal of the American Medical Association, JAMA, Neurology found that long-term use of PPIs, including omeprazole, was associated with an increased risk of dementia in older adults. Another study, published in the Journal of the American Geriatrics Society in 2018, reported a similar association between PPI use and the development of Alzheimer's disease. However, it's important to note that these studies have been observational in nature, and more research is needed to establish a definitive causal relationship. Possible mechanisms behind the link. Researchers have proposed several potential mechanisms that may explain the potential link between omeprazole and dementia. One hypothesis suggests that the long-term use of PPIs may interfere with the body's ability to absorb certain nutrients, such as vitamin B12, which are essential for brain health. Another theory suggests that PPIs may have a direct impact on the brain, potentially altering the production of certain neurotransmitters or contributing to the accumulation of proteins associated with neurodegenerative diseases. Expert opinions on the omeprazole-dementia connection. The scientific community remains divided on the strength of the evidence linking omeprazole to dementia. Some experts have expressed caution, arguing that the current research is not conclusive and that more studies are needed to fully understand the potential risks. Other experts, however, have suggested that the available evidence warrants a more cautious approach to the long-term use of PPIs, particularly in older adults who may be at a higher risk of developing dementia. Precautions and considerations for omeprazole users. Given the ongoing debate and the potential risks associated with long-term omeprazole use, it is essential for individuals taking this medication to be aware of the potential connection to dementia. Patients should discuss their concerns with their healthcare providers and work closely with them to monitor any potential side effects or changes in cognitive function. In some cases, healthcare providers may recommend alternative treatments or lifestyle modifications to manage gastrointestinal issues and reduce the risk of dementia. Alternative treatments for acid reflux and heartburn. For individuals seeking alternatives to omeprazole, there are several other treatment options available for managing acid reflux and heartburn. These include lifestyle changes, adjusting dietary habits, maintaining a healthy weight, and avoiding trigger foods can help reduce the frequency and severity of acid reflux and heartburn. Over-the-counter medications, antacids, H2 blockers, and other non-PPI medications can provide relief for occasional or mild cases of acid reflux and heartburn. Prescription medications. In more severe cases, healthcare providers may prescribe other types of medications, such as H2 blockers or newer classes of PPIs, that may have a lower risk of side effects. Surgical interventions. In some cases, surgical procedures, such as fundoplication, may be recommended to address the underlying causes of acid reflux and heartburn. Lifestyle changes to reduce the risk of dementia. In addition to considering alternative treatments for acid reflux and heartburn, individuals may also want to explore lifestyle changes that can help reduce the risk of dementia. These may include maintaining a healthy diet rich in fruits, vegetables, and whole grains, engaging in regular physical activity to promote cardiovascular and brain health, participating in mentally stimulating activities, such as reading, puzzles, or learning a new skill, managing stress and getting enough sleep, avoiding excessive alcohol consumption and smoking. Conclusion: the need for further research and individualized medical advice. The potential link between omeprazole and dementia is a complex and ongoing area of scientific investigation. While the available research suggests a possible association, more studies are needed to fully understand the mechanisms behind this connection and to determine the true extent of the risks. In the meantime, it is essential for individuals taking omeprazole or other PPIs to work closely with their healthcare providers to carefully weigh the potential benefits and risks, and to explore alternative treatment options as appropriate. If you or a loved one are taking omeprazole and have concerns about the potential link to dementia, I encourage you to schedule a consultation with your healthcare provider. Together, you can discuss the latest research, explore alternative treatment options, and develop a plan to prioritize your long-term health and cognitive well-being.